My name is Monica Naus. I'm the Medical Director at the Communicable Diseases and Immunization Service at the British Columbia Centre for Disease Control. And I'd like to thank you all for coming here and for your passion and commitment to immunization. We've got a great program for you. Our program today is largely based on topics related to the vaccination status reporting regulation and related issues. That's the morning program. And then in the afternoon, we have a focus on Hpv vaccination, which continues to be our lowest uptake vaccine and one where we think that we can get to 90% coverage. And we've got a great lineup today for you of speakers. We also listened to the evaluations from last year, and we have built in more time for networking and discussion, both in blocks of panel sessions with our presenters in the morning and the afternoon, but we also have a prolonged poster session in the afternoon, and that should give you lots of time to dialogue with other attendees at the event. So I hope that you will really enjoy the day, and I'm glad that you were all able to make it, because I know that many of us are working on other things right now. Next year's conference may be about coronavirus vaccination. I'd like to acknowledge that we're gathered today on the traditional territory of the Coast Salish people. And I'd like to thank the Ministry of Health for funding the BC Immunization Committee, which was able to support the delivery of today's program. We've got a couple of housekeeping items for you. The first request is to please turn off the ringer on your cell phone. We've got health and lunch breaks in the program, so take a look at that. Depending on the time of the morning session, we may change some of the timing for the afternoon, because we only have 6 poster presentations and we'd built in time for 10. The washrooms are outside on this floor, and they're readily locatable through the signage. And should there be an emergency, please follow the instructions to the nearest exit. I'd also like to acknowledge and thank the administrative staff who were instrumental in pulling the day together, and they're also here to run around with mobile microphones and to assist with anything that you might need. And we've got Stephanie Dion at the back of the room. Stephanie, just wave. I don't know whether Carol is going to come in and just wave so that you know what she looks like. And Jessica Taylor is the other person who was out at the registration desk, and they're available if you need any administrative assistance with anything. And then we do have...
Yeah, they're there at the back now.
Okay, great. There they are. Carol, hello, thank you, and Jessica Taylor. So if you need anything, and thank you very much. We've appreciated everything you've done to get us here today. And then we've got, we're using a tool called Slido for the questions from the audience. There will be the opportunity to ask questions on mobile mics after each presentation, but we thought that Slido would be a good way to identify the most important questions that the audience has, because there's a way to sort of group source them and to identify if somebody's already written the question that you were going to ask, there's a way to like it so that it gets to the top of the question list. And Christine Halpert, my partner in organizing this event, is here to describe to you how to set it up on your phones, and you'll already have received some instructions from Carol Naus on that.
Okay, so we're just going to do a quick practice round with a couple of really short polls, and I can see that 12 of you have already answered the poll. So if you go to Slido, so it's great. I'm really glad to see that some of you are actually already logged on and starting to get involved in it. So the event number is up on the screen, and the first poll is, how long did it take you to get here today? And so once you open your app, if you go to live polls, click on the BC, that code should take you to the BC Immunization Forum event, and then answer the question. Oh, good, we're up to 37. 50? Oh, good job. Everybody's logging on. Okay, I'm going to move, just in the interest of time, that poll's going to close, and we're starting the second poll, and that's asking, where are you from? And then we'll share the results with everyone. So if you can answer the next question, where are you from? Oh, good. That's great. Everyone's getting right on it. Okay, and I'm going to move to the third one that's asking, what profession are you? Okay. So the results of the poll are that for most people, it took you 30 minutes to 1 hour to get here today. That was 40%. 33% was less than 30 minutes, so I think those are probably the Vancouver coastal folks. 11% took 1 to 2 hours, and then 16% took more than 2 hours. So thank you very much for spending that amount of time to get here today. And then, where are you from? Again, 40% are from Vancouver coastal, 24% from Fraser area, 9% from Vancouver Island, 8% from the BC interior, 10% from northern BC, 8 from other Canadian provinces, and I know I should have added territories because I know we have a great contingent here from the Yukon, so I apologize for that. And I know we have a couple of people here from across the border, but so far, no one says the United States here. And then just one more is, what profession are you? So as expected, we have 67% of participants identify themselves as a nurse, and we grouped all the nursing disciplines together. 6% physicians, no pharmacists online yet, and I know we're really excited because 7% we have naturopathic physicians, so we have 4 representatives from the naturopathic profession here, and they're a newer addition to our immunization family, so we're really excited to have them here. And then we have some administrators and some who identify as others. So we have a really great cross-section of participants today. So that just, you all got onto this Slido really quickly, so that just gives you an idea. Once we get into the question and answer sessions, you'll be able to enter your questions online. We'll also have mobile mics, but this is one way to, and you can see what other questions people are asking, and if you like a question, you can indicate that, and then the more people that like a particular question, that question gets bumped up to the top, and we'll make sure that that question has priority. So thank you very much.
If people are having difficulty with Wi-Fi, I saw that there's a UBC visitor Wi-Fi, and I'm guessing that one may not need a passcode. But please let us know, or let one of our admin staff know, and we can check into that if we need a passcode for Wi-Fi. Pardon me? UBC visitor should be working, right? Okay. Scroll down to the bottom and accept. You have to probably tick a box. But UBC visitor should work as Wi-Fi, so you don't have to eat up your data plan in order to ask questions. So I'd like to welcome, I'd like to welcome Shane Point, whose Indigenous name is T-Tay-In, up to the podium. And Mr. Point is from the Musqueam Nation, and he's a proud member of the Coast Salish people and very respected in his community. And he's a traditional speaker and cultural educator. And I also learned that he is a knowledge keeper appointed by the First Nations Health Authority. And he was here last year to open our event, and I'm very grateful that he was able to make it again this year.
Thank you. Appreciate it. Thank you. Good morning. I like working with little kids because they get so excited and you go, good morning. Work with adults and you all go, oh, yeah, okay, good morning, yeah. Wow. As I was sitting, listening to the gathering of energy that you are, was amazing to me to not only feel that, but absorb it. I'm a limited person in terms of education. So immunization, to me, is an action word. That's what I hear, it's an action. And it's not only an action word for me, but it means that it's about prevention. It's about helping the body to ward off whatever's out there. So I listened to my memories and remembering my own family members saying, you eat this, you eat this, you eat this, you go get this, you make this into a tea, and you're going to be strong. So pre-contact, immunization came in the form of healthy foods, whole foods, what you all call whole foods now. When I'm out in the grocery store and I listen, and you've all now created superfoods. And I was going, wow, my mom knew superfoods before everybody else. So we're preventing. So immunization comes in the form of proper nutrition in my own mind. So I'm grateful to the organizers for bringing you together to listen and to learn so you can help others. I won't ask you to stand this morning. I notice a lot of you have dishes and food in front of you, so not going to ask you to stand. But what I'd like you to do is hold hands as best that you can. Awesome. Saast Hualmuch Mustimuch my friends and relatives, the name that the young lady used, Titan. Titan is my great-great-grand uncle. My mother knew him. She grew up around him. In our family, he was the one who knew, understood, and used medicines to help the family and the community. That's what he did. As I learn, and what I want to share with you are two very important words. The first one is slachen. Slachen, translated, simply means medicine. Slachen, sacred medicine. When my teachers within my family are helping me to come awake, they say to me, we are medicine. When my parents passed away, when I was a teenager, they said to me that all of my relatives who gathered, that they're medicine for myself, my sisters, my mother and father's grandchildren to heal. So, slachen, slachen, you are all sacred medicine. Your medicine. The other word that I want to share with you is the word nutsamot. Nutsamot, translated, simply means we are one. We are one. Which brings me to immunization. As individual human beings, what makes us strong is our family. The support that we get from our family, other human beings. Nutsamot extends beyond human beingness to the world around us. Nutsamot with the medicines. The medicines are nutsamot. We're nutsamot. When we gather those medicines and bring them to ourselves and to others, we get stronger. So we need those things outside of us, those medicines outside of us, to help us to be strong and healthy. My big work is always about children. The work that you do is to help children to be as strong as they can be, to be as healthy as they can be on all levels. So, on behalf of all of the children from Musqueam, their peers throughout British Columbia, their parents and their elected leadership, I welcome you all here to this very beautiful moment where you get to hear the squall, the sacred words from the ones who are going to speak to you. This morning, I met this young lady from Washington. She explains to me her genealogy. So, in a very peripheral way, but nonetheless, we're connected, her and I. We're connected through ancestry. Part of immunization in my own mind, preventative medicine, is genealogy. We don't do that enough. We don't do that enough. It's that history for children and for our families that also help us to be strong. That knowledge of connection further back helps us to be strong. Now we all just think we're individuals. We all think we're tough because we got an education. We all think that we're self-sufficient, and really we're not. We're not somewhat. We're connected to each other, and we're connected to our ancestors. What you can give your nieces, nephews, and children, grandchildren, in terms of genealogy, is immunization. That's immunization. That's helping them to be strong in their hearts and their minds so that their bodies thrive, their emotions thrive, their spirits thrive. So, my friends and relatives, please enjoy the day. Those of you who don't come from Vancouver, have fun. I suggest to those of you who traveled a great distance at lunchtime, sneak out and enjoy our wonderful city. Take care.
Thanking Mr. Point for sharing his wisdom with us. He always has very insightful advice for our group. And it's the first time in a long time that I'm sure it's the same for Chas, certainly for me, that we've been called a young lady. So I really appreciate that as well. Our next welcome is from the Ministry of Health. Laurie Wright is here from Victoria this morning. Laurie has a long history in public health. She started off at Vancouver Island for quite a while with focus in nutrition, but she's been at the provincial level in government in a few different portfolios, most recently as the executive lead for population and public health. And you've joined at a very busy time. Laurie started, I think, just last summer, June, just at the beginning of the measles catch-up campaign and also the regulation. So welcome, thank you for coming.
Thank you and good morning. I've got to put my glasses on because I do have notes here, and I'd like to really thank you for that warm welcome for all of us to gather here in the traditional unceded territories of the Coast Salish people, and also sharing your language. So thank you for that. I'm going to have to think about Nesquimalt. Thank you. That's wonderful. So on behalf of the Government of British Columbia and Ministry of Health, I actually am delighted to be here, and also that we could fund this really important event, and to welcome you to this Immunization Forum. I heard from the poll, some of you have traveled quite a distance from Washington and from parts of Vancouver, but also outside of the province as well. So thank you for coming here today. And also for those watching the webcast, which I think is super cool. Technology today is amazing. I was recently in a course and we used a similar technology, and it was such real time and so amazing to be able to have such engagement of people sitting, because you sit for such a long time throughout the conference of the day. So I think it's amazing. Thank you for organizing the technology. And I'd like to thank the Immunization Committee and also the BC CDC for organizing this event. It's true I joined in June of last year, and started off with immunization, and all of us recognize the importance of immunization. I really appreciated the message of it really is about all of us. It's one of the biggest success stories in modern medicine, and I was thinking about coming here to speak today, and I have a new great niece. She was born in November, and she's getting to the point where she needs her first vaccinations, and so I'm just thinking of how it spans all across our ages and our generations. And my mom is turning 80 this year, and I know that every year she goes and she gets her flu vaccine to keep herself healthy. And so we touch so many parts of people's lives, infants, children's, and also families and communities, to keep them healthy. It improves the quality of lives and reduces morbidity and complications of disease. And it also reduces the unnecessary use of antibiotics and antibiotic resistance. It has so many benefits that it just is one of those fundamental, foundational public health measures that we all do that often is unrecognized because it just is people go and get their vaccinations, but they don't see the important work that goes behind the scenes. I remember my early career as a community nutritionist, and that Kathy's here. Her and I connected, and her and I worked together many years ago. It was awesome to see a face. And how important it was for those moments in time, that patient attachment, quote unquote, or person attachment to the important information and the connection that you have to that individual at that moment, that it's not just about the vaccination, it's also about sharing the information and helping them to know what resources are available and having that face that people can ask those questions to. So it just does so much to create attachment to important public health resources and our primary care providers as well. So it is fundamental for us. This past year, we've been in the news and very active, and I know many of you have been heavily involved in the work that we're doing, and so I'm going to talk a little bit about what we're doing in BC. We had a small measles outbreak in BC, and at the time, many countries were grappling with a bit of the measles outbreak in 2019. We had a minister who became very interested in vaccination. So we've had lots of attention on vaccines and immunizations from the Ministry of Health's perspective. We just successfully delivered our measles catch-up campaign in the spring of 2019, and we mobilized, and I say we, but really the whole province mobilized incredibly quickly using our partnership with Ministry of Education in the schools, communication with parents, and delivering catch-up school health and public health clinics in a very short period of time. So there was no additional resources at the time as well. So it was a fairly significant amount of work that was done, and we were very successful. There was 590,000 immunization records reviewed, 4,500 school and community-based immunization clinics, and we increased the number of fully immunized children in the provincial immunized registry by 37,500. And I think we started in May, early May-ish, and ended at the end of June. So I think it was about maybe 2.5 months that work happened. It was a fairly great success. So I want to thank all of you for all the hard work that you did to make that campaign such a success. Building on the success of that, what it did was identified the need for actually the knowledge. So we talk about the knowledge and the need for information, was that there was a recognition that we really needed to have more information on the immunization status of school-aged children in the province to help us to both better able to manage outbreaks when they occurred, but it was also an opportunity for us to inform and educate parents about the importance of vaccination. And I know that on the agenda today, there'll be continued work on this kind of emerging movement on vaccine hesitancy. So that really important point of contact and that evidence-informed information. So we worked with the provincial health officer and developed a vaccine status reporting regulation. And it requires all school-age children to have an up-to-date immunization record in the provincial immunization registry. It came into force in July 1st, 2019, and then we worked very closely to develop implementation plans because this is a bit of a different approach. It's about record review. It's not about mandatory immunizations. It's really about supporting parents and guardians to submit any missing or incomplete records, and then also to offer immunizations where there may be missing vaccines if possible. So we're really, I'd say the health authorities are very busy right now, working to review records, contact parents, hosting the normal school health clinics and any other immunization clinics, and entering data to advance the implementation. So year one was about starting the implementation and starting that communication with parents and starting to build that provincial immunization database so that all of the records could go in and we'd have this provincial picture. We had a baseline report, and off the top of my head, I think we have about 69.6% of students across the province with complete immunization records, and so we've got some work to do. Out of those missing, I think that there's another 20% who have incomplete, and then I think there's about 10% who don't have records at all. So it really is it's a way for us to really start to build that knowledge, and it helps to inform then what our next actions will be. So year 2 is obviously going to be about continued implementation. So what's going to happen in September is that the second part of the regulation will come into force about education. And so part of year 1 is really about identifying those parents who are with refusal to vaccinate. We recognize that there are some who will have medical contraindications, but refusal to vaccinate. And that the idea being is that there will be an education module available to help with the evidence to support them to make informed decisions. There's a lot of misinformation out right now. Social media is hot on all the concerns about vaccines, and so we want to ensure that at least they get the vaccine benefits and the information to help them make those choices. That will be year 2 for us, and then we'll be continuing to monitor to see if there's any additional work that needs to be done around those areas of the province where, because we'll identify those pockets if there's something else that we may need to do. On the top of education modules, Craig has gone over to Public Health Association of BC to develop our next sort of education modules, and I just want to recognize that the Kids Boost Immunity was a finalist for the Premier's Award for Partnership this year, and so it's a really well-recognized and really exciting education module, and that we're looking to do something obviously for the parents and the children for year 2, and so we've got a great platform and a foundation to work on. So congratulations to all those that were involved in that success. In closing, I would just say that we have an extraordinary group of immunization experts today. I've worked with one of them many years ago, and I really think that this is really about an opportunity for all of us to share and our knowledge and insights and our challenges and our assumptions, and look at generating new ideas and partnerships. I think we've done a lot in immunization or the area this year, and I think we have opportunities to use all of your collective wisdom to see how we can further advance it. So I'm looking forward to the lessons learned from other jurisdictions. We've got someone from Washington here. I'm not sure if anybody else is here. And just to tackle those challenges and meet our ambitious goals. I hope that today's event is everything that you hope it will be and creates new relationships for us to work together. And so I say let's start the conversation. I look forward to a great day of learning and discussion. So thank you everyone for being here today.